Now more than ever, I want to make sure that I'm connecting our community of safety professionals with businesses that have awesome products and are awesome people at the same time. Safety Reports is that company. Whether it's inspections, training, JSAs, or monitoring observations and incidents, they have you covered with high quality and easy to use safety applications. So please take a few minutes to hop on their website to learn more at summit.safety-reports.com. It's time we rally around solid companies that provide an awesome product and great service. Again, that's summit.safety-reports.com. I'm Jake Wolfenden with Summit Safety Group and Safety Consulting Now, and I want to walk our clients through some basic training on the use of homemade masks and what experts are saying we need to do in order to stop the transmission of viruses like COVID-19. Look, the reality is most of our clients are considered essential businesses, and it's important each of you do your part in allowing this blessing of being able to work to continue. Of course, that means working with your employer to ensure your own personal protection by using properly fitted N95 masks by means of fit testing when needed, but it also means finding ways and implementing methods that will protect every single person you come into contact with, especially when you're required to work near a teammate on job sites, manufacturing lines, kitchens, the checkout line, and any other close quarter job task. I can't speak on this as being fact, but my guess is that these current essential businesses will only remain essential if the virus is not being quickly spread through the teams of employees that are present in the workplace. That means we need your help in this. In using safety language, you have to treat yourself as a known hazard. From there, we start to look at the protective elements we can employ that will keep our teammates safe, slow the spread of this virus, and keep you working and bringing home a paycheck for you and your family. One of the most terrifying things about viruses is that they're created to be spread and spread quickly. They do this by infecting the host and not bringing about any symptoms within that host for a period of several days. As many healthcare professionals have said, the most contagious time for this virus is before the host starts to experience any symptoms. That means many of you are walking around with no symptoms for a week or more, infecting people around you, and no one knows. What does that tell you? That reaffirms to me what I just told you a bit ago. You must treat yourself as a known hazard for those you're working in close proximity to. There's no question these are unprecedented times where entire cities are being quarantined. Personal protective equipment is scarce. Healthcare systems are concerned about being overrun with critical patients, and the strict standards and practices we would normally apply are literally impossible to maintain in many different scenarios. When a standard requires you wear a respirator, and yet there are no respirators, you have to employ a series of actions. Social distancing is the most important thing you can do in this case, and yes, even at work. This means taking breaks and meals at individual workstations, not gathering in a break room, maintaining at least 6 feet separation during training and meetings, preferably in open air environments. This may mean scheduling more training groups and offering web conferencing even for those employees still working on site. When certain tasks require employees to work in close proximity, it's requested that each employee wear one of the following: safety glasses or goggles to keep respiratory droplets from entering the eyes, an N95 dust mask or equivalent. If that's not available and the PPE assessment demands, wear a half or full face respirator. Wear a face shield to minimize the distance respiratory droplets can travel. And finally, which is the section we're really going to focus on, wearing a cotton face wrap, bandana, or equivalent if none of the appropriate PPE is available. This will also help minimize the distance respiratory droplets can travel. Now look, with all of the PPE we mentioned, there is required training that must go into the use of each of them. This training should cover, among many things, the proper use, proper size, care, cleaning, hygiene, allowable facial hair like this great diagram from the CDC so nicely exemplifies, and proper storage. It should also include fit testing and medical evaluations when required. If you need help with that training or a fit test, please reach out to your SSG consultant. That's what we do, and we can certainly help with that. We also have our online safety training platform, Safety Consulting Now, that we are offering free temporary access to our active SSG clients. But that said, hold on tight because we're about to embark on some uncharted territory here. Homemade facial coverings. Yes, medical experts are asking they be worn by everyone that may come into close proximity of any individual while you're at work or while you're in a community taking care of your essential needs for all of the reasons we mentioned earlier. Now, there are two main goals when we talk about protection from viruses: protecting ourselves through personal protective equipment, and then there's protecting others from ourselves in case we are in fact infected and contagious with the virus. And as mentioned earlier, we may show no symptoms, or what the medical field refers to as being asymptomatic. And this can take place for over a week and still be highly contagious. Protecting ourselves requires a properly fit tested N95 dust mask or equivalent, and protecting others from ourselves at this time because of the lack of PPE available. This requires a minimum of homemade facial covering. Now, the CDC has given us some direction on this, and I'll get into that here in just a bit, but I want to show you why this is so important. At this time, we are unsure if the virus is spread only through larger respiratory droplets or if it can be spread through aerosols, which are tiny droplets that can hang around much longer than the larger respiratory droplets do. To showcase this, I want you to watch this recent video that was made by NHK World in Japan.
About 10 people in an enclosed space the size of a classroom. A person coughs once and spreads about 100,000 droplets. Large droplets are shown in blue and green. Most of these fall to the ground within 1 minute. But the microdroplets, shown in red, continue to drift. This simulation uses only microdroplets. 5 minutes later, 10 minutes later, 20 minutes later, the microdroplets are still floating in place.
Now, if that doesn't make you keenly aware of every time a person coughs or sneezes, I don't know what will. But listen, we still aren't certain as to whether viruses like COVID-19 are spread by those aerosol droplets. In the meantime, we have to move forward as though it is spread that way. And guess what that means? Yes, you need to do everything you can to cover your face to limit the travel of our potentially infectious respiratory droplets. This means covering our faces. And I want you to watch one more video that does a great job showing how even something as simple as breathing moves the air around us with a lot of force. We see the individual talk, cough, and even cough into his elbow. The other side is what it looks like when you wear a mask. Now, to clarify, this is not a cotton mask, but that doesn't mean the cotton mask is useless. In a Cambridge University study from 2013 titled "Testing the Efficacy of Homemade Masks, Would They Protect in an Influenza Pandemic?" it was determined that a single cotton layer has 73% filtration efficiency of surgical masks for preventing the spread of influenza, but little to no efficiency in personal protection. Though it's a small single study, it provides some hope that even a simple proactive protective method such as this can help our employees that continue to work in essential businesses stay safe while in close proximity. The efficiency is likely due to the fact that the single cotton layer is still able to stop or diminish the distances the larger droplets can travel. Again, we don't have much to work with, but these are the sources that are currently available as we try and navigate all of this. Lastly, I want to get into the CDC's recommendations on wearing cloth facial coverings as a way to slow the spread of COVID-19. First off, we need to talk about wearing them properly. The CDC says that they should fit snugly but comfortably against the side of the face, be secured with ties or ear loops, include multiple layers of fabric, allow for breathing without restriction, be able to be laundered and machine dried without damage or change to shape. Second, they do issue some cautions on their use. They say cloth face coverings should not be placed on young children under age 2, anyone who has trouble breathing or is unconscious, incapacitated, or otherwise unable to remove the cloth face covering without assistance. Third, the CDC says that the cloth face coverings recommended are not surgical masks or N95 respirators. Those are critical supplies that must continue to be reserved for healthcare workers and other medical first responders, as recommended by current CDC guidance. Regarding care, they should be routinely washed depending on the frequency of use. If they're being used at work, they need to be washed at the end of every shift. And it's a best practice that each employee have more than one facial covering so they can change them out during the shift if they become dirty or lose their effectiveness. When you're cleaning them, a washing machine should suffice in properly washing them, and when you're removing them from your face, the CDC says individuals should be careful not to touch their eyes, nose, and mouth when removing their cloth face covering, and wash hands immediately after removing. Now look, this training doesn't seek to cover every detail on this subject. The goal is to provide information on what we think we know right now at the time of this video. So please share it with your employees, train on it, have them sign off that they understand, employ these safety measures, and please, let's each continue to do our part in slowing the spread of this deadly disease. We need to look outside of only protecting ourselves, and we need to look at how we can protect others as well. Keep fighting the good fight, and please reach out to me at jakew@summitsafetygroup.com, and I'll do my best to help you get your questions answered. With that, I'm Jake Wolfenden with Summit Safety Group and Safety Consulting Now, and I'll see you in the next one.